I'm Jim Roach, a family physician from Midway, Kentucky, and I'm encouraging you to consider going to Ashland, Oregon, and learning from one of the brightest cancer minds I've ever encountered. An individual who has thousands and thousands of studies that he has researched and reviewed and has amalgamated those into a plan called ETMS that is dramatically impacting patient health. And having been to Ashland 3 times and brought back that information and staying connected in with Donnie Yance and the Mederi Foundation, it's transformed my practice. I feel confident in managing cancer patients and achieving outcomes that I would never have believed possible in the past. A melanoma patient who had cancer in the liver, lungs, bone wrapped around her spine, and using Donnie's ETMS approach in conjunction with interleukin-2, in 1 month her cancer had died, and it's been 4.5 years. I've had a number of patients that have had positive outcomes. On average, I would say double the expected life expectancy from chemotherapy agents utilizing Donnie's approach. I had a patient come to me and tell me that the chemotherapy nurse said, "Now, aren't you a patient of Dr. Roach's?" And she said, "Yes." "And how did you know?" And she said, "Well, you're doing so well. You look so good. We can spy his patients because they respond so much better to chemotherapy. They have better outcomes, and they don't have nearly the side effects that other patients do." This is a very empowering way. We're in an information age, and the more information we have to understand, to help our patients and utilize. So comprehensive approaches are most important, utilizing nutrition, lifestyle, spirituality, vitamins, botanicals, and incorporating that into conventional approaches using comprehensive markers in the blood along with that, and formulating a plan that helps patients to feel better. They gain vitality, and they sometimes feel better than they felt in years, or possibly even in their whole life, utilizing this type of approach. So at the very worst, they feel great, and at the very best, they may survive many times their predicted life expectancy, or indefinitely the cancer may be in remission or in a dormant state. So I would encourage you to consider attending a workshop where you'll be challenged and enriched and nurtured, and you will learn about your own health in the process, as I have done, so that you can improve your own chances of optimal life expectancy and quality of life. Well, I loved going to Ashland, Oregon, and that's why I went back 3 times to improve progressively my level of knowledge with that. It's a resort town setting. I hiked mountains every morning prior to the sessions with ETMS. You're in a loving spiritual environment. You gain relationships and friends that you will have for life in that setting. I remember the first time that I learned about botanicals. I went to Columbia University, and when I went there, I just went on gut intuition. I didn't know how in the world I would ever use botanicals in my practice. But then I came back and immediately started applying that. And then when I studied under Don Yance, that just multiplied. And now my skin is almost orange from all the turmeric that I consume. I take smoothies. I spend an hour each morning formulating a smoothie because I know how much of an impact it has on my health. I know how much better I feel. And it's just great being in that setting of love and spirituality and learning. I want to learn as much as I can, as fast as I can, and it just enriches your life to do so in that setting.